Greetings, well-beings. We're back with another reaction to the hit show on HBO Max called The Pitt. This show is incredibly honest and true. It's the most accurate depiction of medical TV I've ever seen. We're in episode 13, which remember, each episode is 1 hour of the shift. So we're in hour 13 of a 12-hour shift. So keep in mind, these people are tired and they're going through a lot of stress because of the mass casualty with an active shooter at the Pitt Fest. Let's break it down. Here we go.
Who else needs blood?
Everybody.
Leave us 4 units, 4 next door, and then check in with Robbie and Abbott.
Great decisions. Love that decisive nature.
Hey, Whitaker, how you doing?
Yeah, fine.
Ask for help if you need it.
Oh my gosh, so good. How they're checking in with each other, even though all of that stuff is happening. Dr. Robbie's awesome. He is checking in with Whitaker, and it's so good.
Innovated by now.
Yeah, what's his pulse ox?
All right, it's time for his partner, all of you. Into PH2 now. You can watch from the window, but you need to zip it, capiche? Bridget, thank God, night shift to the rescue.
Okay, Dana's lost her patience because the SWAT team that's like, why isn't this person intubated? Why isn't our buddy intubated? Because SWAT teams are cross-trained to be medical professionals as paramedics, and sometimes they're even physicians. They're in specialized training, so they're like, why aren't you guys doing the things that we would have done faster? And I just love Dana's charge nurse personality, where she's just so straightforward and commanding. She's like, it's really important that leadership is clearly delineated, especially in traumatic, chaotic situations. And night shift just showed up. Keep in mind, this is now not 7 p.m., which is when it should have ended. It is 8 p.m., between 8 and 9 p.m.
Tried to get here sooner, but it is gridlocked out there. Did you hear anything about the shooter? They may have slipped away in the crowd with all this chaos.
Can you tell me your pain on a scale of 1 to 10?
At least a 3.
And can you wiggle your fingers? The other hand?
Uh-oh.
Hilarious that he wiggled the fingers of the hand that was fine when she was asking him to wiggle the fingers of the injured side.
We're gonna put you on some IV antibiotics and some pain meds.
Is it just me, or does this clown look like he could also be the shooter?
Hey, am I gonna lose any dexterity?
Too soon to tell, but probably not. Okay, you're gonna feel a little pinprick here. Ah!
Oh my God. He just drilled the drill into the bone. So what he's doing is IO, intraosseous. There's different ways we can administer medications or we can take medications. One is by mouth, which is called PO, per oral. 2 is intramuscular, which is like when you get a shot for the vaccine, penicillin shot if you have syphilis, or and you need an antibiotic for some reason and they have to give it to you in your butt. That means it's going to the glute muscle. It's intramuscular. Subcutaneous is right underneath the skin. And that's what a lot of people, diabetics, use, like insulin needles. They're really short, tiny, thin needles. That's subcutaneous. And Whitaker just tried to drill a hole into his humerus, which probably hurt.
Antibiotics.
Oh, that hurt just as bad as when I got shot.
You put in an IO?
Yeah.
Don't worry, sir. There will be no more pain.
Oh, I forgot to mention intravenous. Intravenous is one of the most significant ways we give medications in the hospital. It goes directly into the bloodstream. So you're thinking of like putting a tube inside the tube so that you can free flow medications or fluids through the vein. That's called IV.
An entrance.
Whoa!
Whoa!
He's going for his gun.
Whoa, whoa, whoa!
Stay down! Sig P365 9 mil. All clear.
Sure?
He's unconscious.
Ooh, I can't actually tell from this angle what happened, but it looks like the guy was delirious, agitated, and then trying to reach for his own gun.
Concealed carry permit. We'll run his ID.
Concealed carry permit? Wow, that's fascinating. I feel like there's probably so many people walking around with guns and you don't even notice it because they have the permit. What's also crazy is they have to keep working on him even if he is potentially the shooter.
He needs a big central line for a fast transfusion.
You'll kill him if you collapse so long or hit the carotid.
I'm not doing an IJ. This is a supraclavicular subclavian. This is the only safe way to access the giant vein. A centimeter from the lateral head of the sternocleidomastoid, a centimeter off the clavicle. I'm in. Okay, resume compressions.
Okay, so I just talked to you about intravenous access of medications. So there's different sized veins in the body. When we say central line, we mean we're using a central vein that goes directly to the heart. We think of the internal jugular vein or the supraclavicular vein or even the femoral vein. And getting a central line means you get faster access to medications directly to the source. He did a subclavian. We do it blind. I did a bunch of these when I was in residency, but because I'm not an intensivist, I'm not an ICU doctor or an ER doctor, doing central lines is not part of my bread and butter practice.
There was so much blood, I tried to stop it.
Jake,
Robbie, Leah got shot. It's really bad.
Oh.
Are you shocked?
I don't know, maybe my leg. Most of this is her blood.
Okay, come on, let's go. Let's go. I got you.
Jake.
That's his stepson. And you know, when medical professionals are taking care of their own, it's like good and bad because they'll take like extra good care, but then also it's bad because they're like emotionally involved.
No room, and we need to work on Leah right now. You need
Please come tell me how she's doing, okay? Please.
I will.
Can't feel crowded.
You start compressions.
Oh.
Swap out with me. I need an IO. Hang a unit of egg.
Leah?
Yep.
You need help over there?
Nope, we're good.
It's Jake's girlfriend.
Oh, who's Jake? It's like Robbie's stepson.
How's Robbie with Leah?
1,400 of blood at the chest, first unit's in.
in the
Gosh.
second unit fast, and then we'll do another pulse check for FFP and platelets.
You sure, Robbie?
So if we get the plasma, swap.
They're all like giving him side eye and glancing from all over the ER and she's like, "Are you sure, Robbie?" Because it's obvious that she's non-resuscitatable. You know, it's a sad word to use, but in medical lingo, we say the word expire, like when a patient's expired or when they've passed away or when they, you know, call the time of death. There's only so much you can do to a body that's not coming back. Yeah, you can just tell right there.
1 second.
What are you doing?
Checking the retina
For detachment?
for intracranial pressure by measuring the optic nerve sheath. Holy shit.
Super
10
cool.
millimeters.
What's normal? 5?
The retina is the back of the eye. Okay, it's as the retina closes together, it creates the optic nerve. He's measuring the intracranial pressure through a device that just gets placed on top of the eye.
Pressure's been building up. There's no blown pupil.
Yeah, not yet.
Yeah, he needs a 1-inch burr hole with a cranial drill. I'm just gonna see if neurosurgery is here.
I got betadine and a 10cc syringe.
Oh my gosh, this IO machine drill.
Leaving.
No! God, please, no! No! No!
She just stuck an intraosseous drill into the side of the skull to relieve the pressure of all the buildup of the blood in the intracranium.
Intracranial pressure so he doesn't die. That's sick. I get the next one.
Oh, that's not on me.
Saw you doing CPR. Let's go.
2 liters out of the left chest. Got a pulse back after 3 pack cells.
I'm not feeling it.
Check a carotid.
Nothing, sorry.
But you just had a pulse.
Not now. We need a pulse go to the OR. Call me if anything changes.
Oh my gosh, at least somebody knows how to say no to Dr. Robbie.
No.
Like he tried to take her to surgery because like maybe, I don't know, they could fix something in surgery, but she's not perfusing.
Hemostatic bandage still in place. How you doing, Carmen?
Not so great.
It looks arterial.
Agreed.
Can you stop it?
Direct pressure for now.
Arterial bleeds are very hard to control because they have a lot of pressure. So arteries are little tubes that take oxygen-rich blood from the heart to the organs. So they come with a little pressure because the heart pumps and it gives pressure to the tubes. So an arterial bleed is very, very difficult to control without surgery.
Put pressure on it. Try and stop the bleeding.
For how long?
As long as it takes.
Yeah, where they are right now, they just have to put pressure. And the type of pressure that Whitaker has to put on the bleed is like whole body pressure, like straight arms, an enormous amount of pressure to try to just not let that arterial bleed get too out of hand.
His injuries were really serious. She stopped breathing, put a tube down her throat to deliver oxygen. We were able to drain the blood that was collapsing her lungs. Gave her as much blood as we could. We even transfused some of her own blood that was in her chest. But we were unable to get ahead of the massive blood loss. Her heart stopped. You saw me doing CPR.
So this is breaking bad news, which unfortunately, like everyone has to do as a medical professional. It's not if they have to do it, it's like when they have to do it. And the way Robbie's delivering this information is like a play-by-play. All the events as they happen neutrally, like she stopped breathing, we put a tube in her throat, we did this, and then that did that. Like the play-by-play is so important for the brain to process the things that happened right before that.
Okay, you're gonna need an ultrasound, x-ray.
Not today.
Have you done this before?
It's a central line. Just need to hit the femoral artery. Like that. Piece of cake. All right, guide wire and introducer sheath.
Santos is doing a Reboa.
Oh, no way.
Yes way.
No, we need an attending or...
A Reboa is a resuscitative endovascular balloon occlusion of the aorta, and it's done to minimize the bleeding in trauma patients, particularly when traditional methods are not working. You have to insert a catheter with a balloon into the aorta to temporarily block blood flow, buying times for the surgeons to address the source of the hemorrhage. It's a bridge therapy, meaning it's a temporary solution.
It's not your fault.
Why couldn't you save her? I mean, this is what you do.
I tried. We all did. If this had been any other day, man.
If it had been any other day, what the fuck does that mean? Any other day, what, you would have saved her life?
Yes, no, I don't know. I don't know. We're getting
thing to
slammed up
say.
there. We've had dozens of shooting victims. You've seen it. The fact that we've saved as many people as we have is a fucking miracle.
What you did to save Leah?
No, I didn't. And I don't know how many people I've helped today, but I can tell you every other person who has died. Spencer, who died in front of his children, and an 18-year-old who was brain dead from a fentanyl overdose. And I'm gonna remember Leah long after you've forgotten her. Oh, fuck. I'm sorry. Sorry, you gotta go, man. You gotta go.
Wait, Robbie, wait.
Okay, he's having like... I hope Noah Wiley gets an incredible award for this performance. That was so real. He started developing a panic attack because he realized that he didn't know what he was saying, really. He just got trauma and shock, and he knew exactly who he had lost that day. And this is the toll that healthcare workers are taking all on their own, and they don't really have anyone to talk to. That's it for this week's video. Let me know what your comments are in the comments section. Be sure to hit like and subscribe. And if you want to check out this other video, here is episode 12.